Good morning again. This is Dr. Bill Wyatt, and we're going to talk about a lady here that had a botched orthodontic problem, and her work was done out in Arizona somewhere, and she came back to Oklahoma, and a lady that I had in course referred her to me. So she's hopped around all over the place, and she had had some teeth removed up above, and this was a mistake. So we had to go in and open the gaps up to make this work. So I had to move her upper front teeth forward, and we used a lip bumper. And this is the essential part in here. If you're moving upper or lower, especially lower teeth out, you need to run interference for the teeth. You've got to have a soft vascular bed in front of the teeth. So we use a lip bumper that doesn't touch the teeth or the tissue at all. It just moves out and gives you some space to go in. And we were able to do this. And she was here studying mortuary. And there's a lot of other interesting things happened during this case, but I won't bring that in. But if you're interested in doing something like this, you can go look at the whole deal. Let me change this over here, and it's not working here. Well, let's just a second here. Okay, here is her face before and after. There's not a whole lot of difference except that she's fuller in the face, and we opened up space for her bicuspids that had been removed up there by mistake, and she had that filled in. So we had to use a lip bumper. Now the lip bumper looks pretty ferocious when you look at it. It's a wire lip bumper. And actually, it's very comfortable. It's made out of an old 4-0 wire. And if you're interested in doing that, go check the whole video, and it'll show you how we did this and put that in. Now that keeps the tissue, the lip pressure off of the tissue so that you can form a nice vascular bed in here, and the teeth can move out against that. And that's something you need to think about, especially when you're advancing lower anterior teeth here, and they have a tight mentalis muscle. That's kind of hard to push teeth into something like that. So you need to run interference for them, and lip bumpers are an excellent tool that we use in orthodontics. So I hope you learn how to use them. Here she is again after we finish. And this is the essential things in here. You're going to run onto some cases that have been kind of messed up, or just have a problem case, and you just have to improvise methods of doing something. And we can make space in here and bring the teeth forward, but you have to run interference when you're running into tight lips. Now you can expand the cheeks without running the interference, but not the upper's not as bad as the lower teeth. But you should all learn how to use lip bumpers, especially need them over the lower part of the arch. And so I'm going to sign out here, and thank you for watching. And if you're interested, click in on the main deal and look at the whole video. Thanks again for coming, and I hope you'll join our group and subscribe to that. So I'll say goodbye here.